Hello and welcome. Today we're diving deep into a relatively uncommon, yet significant heart condition, coronary artery aneurysm. We'll explore what it is, what causes it, how it's diagnosed, and what treatment options are available. Join us as we unravel the complexities of this vascular anomaly. So, what exactly causes a coronary artery aneurysm? Unlike more common heart conditions, the etiology is diverse. Atherosclerosis, the buildup of plaque in the arteries, is a primary culprit, especially in adults. However, in children, Kawasaki disease, a condition causing inflammation of blood vessels, is a leading cause. Other potential contributors include connective tissue disorders like Marfan syndrome, infections, trauma, and even certain inflammatory conditions like systemic lupus erythematosus, polyarteritis nodosa, and Ehlers-Danlos syndrome. Sometimes the cause remains unknown, termed idiopathic. Let's talk about the pathophysiology. Essentially, a coronary artery aneurysm is an abnormal dilation, or ballooning, of a segment of a coronary artery. This weakens the arterial wall, making it prone to rupture or thrombosis. The dilation can disrupt normal blood flow, potentially leading to ischemia, or a lack of oxygen to the heart muscle. Furthermore, blood clots can form within the aneurysm and travel to smaller arteries, causing blockages and potentially leading to heart attack. The aneurysm can also compress adjacent structures. While coronary artery aneurysms are not common, understanding their prevalence is crucial. They are found in approximately 0.3 to 5% of individuals undergoing coronary angiography. The exact numbers can vary based on the population studied and the diagnostic criteria used. As we mentioned earlier, the causes vary with age. In adults, atherosclerosis dominates as the primary cause, while in children, Kawasaki disease is the most frequently observed association. More males than females have coronary aneurysms. The signs and symptoms of a coronary artery aneurysm can be quite varied, and sometimes there are no symptoms at all. When symptoms do appear, they often mimic those of other heart conditions, making diagnosis challenging. Some people may experience chest pain or angina, similar to that caused by coronary artery disease. Shortness of breath, fatigue, and palpitations are also possible. In more severe cases, where the aneurysm leads to a blood clot or rupture, symptoms of a heart attack, such as severe chest pain, sweating, and nausea, may develop. Diagnosing a coronary artery aneurysm requires a careful evaluation and specialized imaging. Coronary angiography, an invasive procedure using zinc contrast dye, is the gold standard for visualization of the coronary arteries. However, non-invasive imaging modalities like CT angiography, CTA, and MRI angiography, MRA, are increasingly used for both initial evaluation and follow-up. Echocardiography, especially in children suspected of having Kawasaki disease, can also be helpful in detecting aneurysms. It is important to also consider if the patient has risk factors for the above etiologies. Coronary artery aneurysms can be classified based on several factors. One is their morphology. They can be saccular, resembling a pouch on one side of the artery, or fusiform, involving a more uniform widening of the vessel wall. Another classification is based on size, with giant aneurysms being larger than 20 millimeters in diameter. Additionally, aneurysms can be classified based on their location within the coronary arteries, with the right coronary artery being the most commonly affected. Treatment and management of coronary artery aneurysms depend on the size, location, and symptoms of the aneurysm, as well as the patient's overall health. Asymptomatic, small aneurysms may be managed conservatively with medications like antiplatelet agents and anticoagulants to prevent blood clot formation. Larger or symptomatic aneurysms may require more aggressive interventions. These include surgical repair, where the aneurysm is resected and the artery is reconstructed, or percutaneous coronary intervention, FPCI, with stent placement to support the weakened artery wall. The specific approach is tailored to each individual case, considering the risks and benefits of each option. Preventing coronary artery aneurysms starts with addressing the underlying risk factors. For adults, managing cholesterol levels, controlling blood pressure, maintaining a healthy weight, and quitting smoking are essential. In children, prompt diagnosis and treatment of Kawasaki disease are crucial to prevent the development of coronary artery aneurysms. Early detection and management of connective tissue disorders can also play a role in reducing the risk. The prognosis for individuals with coronary artery aneurysms varies widely. Small, asymptomatic aneurysms may have a relatively benign course with careful monitoring. However, larger, symptomatic aneurysms carry a higher risk of complications such as rupture, thrombosis, and heart attack. Recent research is focusing on developing more precise imaging techniques for early detection and risk stratification. Furthermore, studies are exploring the potential of new drug therapies to stabilize the arterial wall and prevent aneurysm progression. Minimally invasive surgical techniques are also evolving, offering potentially improved outcomes for patients requiring intervention.